I'm Doug Johnston. I'm the Chief of Cardiac Surgery here at Northwestern Medicine and the Bloom Cardiovascular Institute. And with me is Ilana Lupovitch, Nurse Coordinator in our FAST program. And we're here to talk about what is FAST.
Yeah, so FAST is basically our way of helping referring providers and patients get into our system faster and get from referral to OR as quick as they can. It also provides someone clinical at the beginning, so the first person that you talk to will be a nurse to help you sort of guide through that process, to answer clinical questions, to get your testing in order, and to get everything you need ready for your meeting with the surgeon as well as for surgery itself.
So I'm a physician, I'm out of state. I don't know anybody in Chicago. I have an idea that maybe Northwestern has some expertise that would benefit my patient. How do I start the process and who am I going to talk to?
Yeah, so you can send a referral right to us. Really all we need is the patient's name, birthday, and phone number, and we'll be able to reach out to the patient within 48 hours. We'll work on our end and getting imaging in for the surgeons to review. And then we can also get the patient scheduled for any testing, whether that's here in Chicago, or we'll work with you to get testing scheduled locally for the patient so that our surgeons have all the information they need to make a clinical decision for what the patient needs.
Tell me a little bit about what the results have been of the FAST pilot that we did, how patients liked it.
So we actually did some studies on it, and we found that we reduced the number of days from the initial referral to the OR for the patient. So we did a survey of patients who worked with the nurse coordinators and found that there was about a 92% satisfaction with having someone clinical that was with the patient from the get-go.
So how do you see the program expanding in the coming years?
I mean, we've already seen some expansion so far. We've already implemented it into other programs within cardiology, interventional cardiology, and also in our valve program. But I think in some of these niche programs, whether that's surgery or not surgery, I think it'll be really helpful to have nurse coordinators as the sort of gatekeepers to the providers.
Are there any unique needs for patients or physicians that you've had to deal with since starting with the FAST program?
I think a lot of these patients are really anxious. A lot of them are looking for second opinions. They've been told they need heart surgery, and that's a really big deal. I think having someone who understands the clinical side can help the patient. A lot of these patients are coming from out of state or even out of the country. We've had patients since I've started who come from Venezuela, from the Middle East, from all over. And so working with them to get their imaging in, to get them to the States, to get all their testing and appointments scheduled in a way that's efficient for them has definitely also been a need.
It's great that patients are able to talk to somebody who actually has expertise in their problems, and that the first person you get to on the phone is going to be who manages you through the process. And frankly, it's great for us as well, knowing that you're running the show. Thanks again for joining us to discuss the FAST program today.